This is Carissa Enright. This is the continuation of a series of videos that will cover the medication categories most commonly used in psychiatry. The tricyclic antidepressants were lauded as a better alternative to the MAOI drugs because there are no dietary restrictions. And as you can see by this timeline, they were the only other option for 30 years. However, the sound bite for tricyclic is deadly overdose. When you go to the pharmacy to get a prescription filled, how many pills do you usually get? Enough to last a month, right? With a tricyclic antidepressant, a full month of medication at a normal daily therapeutic dose, taken all at once, is an overdose. Again, this presents a difficult nursing situation. The meds we give to lift a life-threatening depression are toxic enough to cause a suicide. To make matters worse, it takes at least 2 weeks to become effective against the depressed mood. It works like this. Depression comes with a lot of physical symptoms. Fatigue and psychomotor slowing robs you of energy. So in the depths of the depression, people might do a lot of thinking about suicide, but they lack the energy to do it. This person is thinking, I don't have a gun and I don't have any pills. How can I kill myself? I could drown myself in the pool, but I don't have the energy to get there. Or I could stab myself with a knife, but those are all the way in the kitchen and I can't drag myself there. The action of all antidepressants, old and new, is to improve energy first. The depressed mood lags behind. Now, look at this suicidal person. Still miserable, still depressed, still suicidal. Yet they now have the energy to get to the pool, get a knife, or whatever. Very dangerous, right? Nurses, don't ever forget that all antidepressants come with this danger. Those first few weeks of treatment are higher risk for suicidal actions. The tricyclics are not commonly used for depression today because the newer medications have fewer bothersome side effects. In particular, these medications are sedating. Over time, the body will habituate to the sedation and it will not be a problem. But at first, every dose increase meant the patient had a couple of days when all they wanted to do was sleep. Currently, nurses will see the tricyclics used in low doses to augment pain control. At larger doses, they are often given as a sleeping pill. Trazodone, technically not a tricyclic, but is chemically related, is frequently prescribed as a sleep aid. These are the notes provided in your course on these medications. All this information has the potential of being tested on your next exam.